morning, Ms. Blake. My name is Abby. I'm going to be your nurse today. I'm just finishing up washing my hands. Could you tell me your name and date of birth? Okay, thank you. So today I'm in here for, it's called a bubble key. It's about your after baby assessment, postpartum assessment. So bubble key is an acronym that stands for breasts, uterus, bladder, bowel, lochia, which is a little bit of bloody discharge after giving birth, episiotomy. Then you've got possible hemorrhoids and Hohenstein, and you have emotions. So I know people have been poking at you and it's kind of uncomfortable. I'll try to make this as quick as possible. So I'm just gonna put on my gloves. Okay, so I'm ready to lean in and palpate your breasts. Please don't be, it's strictly, okay, so I'm gonna palpate your breasts. Okay, your breasts are still soft and they will firm up as milk lets in, and we want to watch out for engorgement. So we want to make sure they stay firm. They can stay firm and soft, but you don't want them to get hard or shiny. It might mean they're overfilled. I didn't see any leakage either, so that's good. Next, we're going to check your uterus. So I'm going to have you lay down. I'm going to lean back the head of the bed. Okay, so I'm going to cup under here. I'm going to feel the top. Your uterus feels firm. It's midline. It's right at the umbilicus, it looks like. It feels like. It's not, there's no lateral deviation. And at the same time, your bladder feels empty, so that's good. We want to make sure your bladder stays empty the whole time, because if your bladder becomes full or distended, it won't let your uterus contract, and that can lead to increased bleeding or excess bleeding that we don't need. And so, when was the last time you got up to use the bathroom, to use the restroom? Okay, recently? That's good. So yes, we want you to keep getting up on a routine schedule and going to the restroom and going pee, and then eventually going having bowel movement. So next, I'm going to look at your bowels, or more or less your intestines. So I'm going to palpate them a little bit. And so you say, have you had a bowel movement yet? No? Okay. So that's pretty normal. Bowel movement will normally happen 2 to 3 days after giving birth, because your stomach and your intestines have been pretty empty. So I'm going to listen to them next. Well, you have hypoactive bowel sounds right now, and that means they are underactive, but that's because you haven't eaten in a while, hence why you also haven't needed to go use the toilet for bowel movement, but that's all okay. We just want to make sure that we eventually get up and do that, because we know you've had episiotomy, and you might need some stool softeners with that to ease the flow, so that's prescribed, and we'll see, you can use it if we need to, if it's too hard to go to the restroom. Next on bubble key is your lochia. So will you please spread your legs in like the butterfly shape for me, please? Thank you. So I'm just going to be looking at under the pad. So your lochia should be rubra or red about 1 to 3 days after. It'll then become serosa, which is kind of brownish pink. And then eventually, to about 10 days, and then eventually it'll become alba, which is the white stage of just discharge. And that's pretty normal and expected, and that can last 4 to 6 weeks for the alba, the white stage. However, yours looks really excellent. It's moderate scant amount. Scant to moderate amount, it's great, good sign. If you start seeing large blood clots about that big, or start to see profuse bleeding during the rubra phase, the red phase, please notify me or your provider while we're still in here, because that could be a sign of excess bleeding, or that you may have had a blood clot, as well as if you start seeing rubra, the red bleeding, after going into the white stage, please notify your provider, because that could indicate more bleeding or things like that. And actually, if you have blood clots when you're still on the rubra, the red stage, that are large, it could be retained fragments of placenta, and we need to get those out immediately. So after assessing your lochia, we assess your episiotomy area, or if you had a laceration, we assess there. So we are going to assess for, if you just lift we're going to have you turn to your side with your leg over you, like that. Thank you. We're going to check for this acronym known as RETA when you have an episiotomy. So we're going to check for redness, edema, ecchymosis, drainage, and then for approximation. So I don't see any redness. I don't see any swelling or bruising. There's no drainage, and it is well approximated, meaning your suture, your stitching lines are healing nicely. It's well approximated. So you look excellent. You can roll back over. Okay, we can sit you back up. So do you have any questions so far about your breast, uterus, bladder, bowel, lochia, or episiotomy areas? Okay, we're going to move on to, I didn't see any hemorrhoids while we were checking there. So when you were laying like that, I could see if you had any hemorrhoids around your rectal area, and there were none, which is good. Now I'm going to check your Hohmann sign, which is to check if you have any DVTs or blood clots. So let me know if this hurts. So I'm going to push up on your heel. Is there any pain? No? Good. This one? Excellent. So and they're not red or warm to the touch. So what I want you to notify your provider, or if we're still in the hospital, me, if you start seeing that your legs are turning red, super warm and tender, swollen, that can be a sign of the DVT, and we need to take care of that immediately. And so then the last part of our Belleville HE assessment is emotions. So after giving birth to baby, there's lots of hormones being released before and after, and things can get pretty crazy. So a common thing is called it's called baby blues or postpartum blues. It's just when you be tearful, but then your mood can swing one way or the other, and we just want to watch out for that. It's a pretty normal part of giving birth. Up to 85% of people will have it. And it goes away naturally. There's no need to get treatment. There's no risk to your baby. So we just want to watch out for that. And then there's postpartum depression, which we're also looking for, and that's more serious. That's when things get overwhelming, and sometimes you just can't do the daily parts of living, and if you want to hurt yourself or baby. So if that arises in your home, I want you to put baby in the crib on her back, close the door, leave the room, and call your doctor right away. We don't want anything happening to your baby, okay? So please tell me about how you're feeling right now. Oh, you're excited, you just had baby. Excellent, I'm glad to hear that. It's a really beautiful moment. It is. Wow. It seems like, your assessment went really well. You seem to be healing excellently after giving birth. So another nurse will be in here later to check on you. Thank you for letting me do your head to toe assessment. I hope it wasn't too uncomfortable. Okay. Bye, Miss Blake. I will see you later. Hand sanitize more. Hi, Miss Billings.